feeling lonely increases the risk for dementia and cognitive impairment by 31%. The study analyzed data from more than 600,000 participants across 21 longitudinal cohorts, making it a super comprehensive investigation. And they were looking at the impact of loneliness on cognitive function. And they found that loneliness increased the risk for dementia at a magnitude similar to the impact of being physically inactive or smoking. And so they found that feeling lonely increases the risk for dementia and cognitive impairment by 31%. And more specifically, it's broken down by loneliness increasing the risk for Alzheimer's disease by 14%, vascular dementia by 17%, and cognitive impairment by 12%. And like I said, equating the risk to that of being physically inactive or smoking, which is profound. And so the researchers here differentiated loneliness from social isolation. They said loneliness is the distressing feeling of having fewer or lower quality social interactions or connections than one desires. So that, I think, is a key point. Than one desires. It's different from social isolation in that social isolation is the lack of social contacts and having few people with whom to regularly interact. So, for example, people can live alone and not feel isolated. And indeed, many older adults live alone and do not feel isolated, whereas there are other older adults who live alone and do feel isolated. So we can't generalize to people who live alone. And conversely, there are people who can feel lonely while being with others. More and more, it's encouraged to screen for loneliness and isolation in healthcare systems. And so I'll link to 2 screening tools that are recommended that are easy to implement that will help you screen for loneliness and isolation. I teach about them in my comprehensive certificate program on mental health and aging, and I'll link to these 2 screening tools in the show notes. So then not only do we need to be screening and addressing loneliness and isolation among older adults, we also need to be addressing it. So you identify loneliness or isolation, now what? And there are some great resources like social prescribing. There's a physician in a Midwestern state who, when she identifies loneliness or isolation, prescribes, gives an actual prescription for her patients to go to the local coffee shop where there are lots of get-togethers and programs for people, like knitting circles and all sorts of informal groups and programs. And so that's an example of social prescribing. Senior centers are another great place. I'll link to an NPR clip where they were talking about a senior center in Koreatown in Los Angeles and how that senior center dispelled myths and misconceptions about what it means to participate in senior center activities. So I'll link to that in the show notes. I find that sometimes just showing my clients a little preview of what activities might be like. If you're like me, you've heard from many older adults, well, I don't want to go to a senior center. Those aren't my people, when indeed it's just a misconception. And so giving a little sneak peek as to what it's like to participate by sharing an NPR clip or an article can be helpful. So I'll link to those in the show notes as well. And of course, I'm linking to these studies if you want to dive deeper.